Today, I would like to make some comments on this very, very interesting article published on JAMA. This is an original investigation. It is a paper by Ferenc and Sabatin and Nichols. The title is Association of Genetic Variants Related to Combined Exposure to Lower LDL and Lower Systolic Blood Pressure with Lifetime Risk of Cardiovascular Disease. There are a couple of major points that I would like to make. One is that this is a Mendelian randomization analysis of 440,000 volunteers. In this paper, what the authors did, they made an analysis, and they found that people with genetic variations related to lower LDL cholesterol, lower systolic blood pressure, if you put them together, so basically what happens is that, volunteers with genetic variations associated with both a lower LDL cholesterol by 14 milligram deciliter and a lower systolic blood pressure by 3 millimeter of mercury had an odds ratio of 0.61 for major coronary events, including coronary death, myocardial infarction, and coronary revascularization, meaning that these people, they had a 39% lower risk if during their lifetime they had, compared to the average, Western people living in Western countries, if they had a lower LDL cholesterol by only 14 milligram deciliter and lower blood pressure by 3 millimeter of mercury. But what is more striking in this 4x4 factorial analysis is that the volunteers, the participants with a combined exposure to lower LDL cholesterol in the range of 38 milligram deciliter and a lower blood pressure in the range of 10 millimeter of mercury, they had a odd ratio of coronary events of 0.22, so 78% lower risk of major coronary events. Of course, this is a genetic reduction of LDL cholesterol, and so these people, they are born with these lower LDL cholesterol and lower systolic blood pressure, and so they had a lifelong genetic lower exposure to cholesterol and blood pressure. However, we know from many studies, observational and randomized clinical trials like the one we have conducted, that it's possible to have much lower LDL and blood pressure. For example, in the cronies, the average LDL cholesterol is 80 milligram deciliter, when the average it's 120 milligram deciliter, so it's 40 milligram deciliter lower than the average, and blood pressure in this individual is 100/60. That is again, 30, 40 milligram deciliter lower than the average. You have to take into account that people older than 50 years old, at least 50%, they have high blood pressure, so a blood pressure higher than 100/90 in the Western population. If we look pre-hypertension, so blood pressure higher than 120/80, we have basically 90% of people older than 65 with pre-hypertension or hypertension. So these values are totally in line with a healthy lifestyle, with a healthy diet. We can achieve those. And as shown by other studies, by the Framingham Heart study, the reduction in terms of cardiovascular disease is potentially huge. and the healthcare saving is also huge. And in contrast, in our sick care system, we are wasting a huge amount of resources to treat diseases that typically take 20 to 40 years or 50 years to develop, and we treat them, we keep them under control because we are not curing the disease. We just keep the people under control with drugs, or we end up, to treat these people with aortic bypass or stents, and with huge costs for the society. And we know that that's not possible anymore. That the financial cost of these sick care systems are totally unsustainable. Thank you.